Hello, and welcome to today's webinar with Exercise Etc. Walk the Walk, Functional Ambulation Drills. This is going to be a great topic, trying to get people not just walking more, which I think we all know is important, but setting themselves up for success so that they can handle this added impact and activity in their life and be more successful with it. Before we get into it, I wanted to let you know a little bit about myself, who you're going to be listening to over the next few hours on this topic. My name is Mike Diebler. My background in fitness is I have a bachelor's degree and master's degree in sports and exercise science. I'm currently the owner of San Diego Premier Training. It is a private personal training studio in San Diego, California, and I am the owner, but I'm also still training. So I love applying the things that I personally do with my clients in these different lectures and webinars that I do. I'm also the director of education at Exercise Etc. And I also am an adjunct faculty at Miramar College. I teach a few different courses like exercise physiology and fitness assessments. And I do other consulting, and I'm a subject matter expert in a few areas with a few other organizations. So I have a pretty wide variety of knowledge and background, and I'm excited to share things that I've learned, researched, and that I currently do with my clients with you today. Now, if you haven't taken a course, a webinar with Exercise Etc., I just wanted to take a minute to walk you through the process so you know exactly how you're going to get your CECs so you get credit for this course. So first, you are going to view the complete webinar. So you have to view the webinar in its entirety. Once you finish, you are going to log on to our website at www.exerciseetc.com. At the top, you are going to click on the Administration tab, and there you're going to go into the Webinar on Demand certificates. Now, be careful. You have to select the exact title for the course that you are taking. So this is Walk the Walk, Functional Ambulation Drills. There are some titles that are very similar. We want to make sure that you get credit for the test that you are, or for the course that you are taking. And there will be a short 20-question quiz that is required. So I want to make sure that you are getting the correct quiz based on the course that you have completed. Once you finish your quiz, there will be a brief evaluation. You're going to let us know what you thought of the course. And then from there, you're going to fill in the required fields and click Get Certificate. Once you do that, you will get your certificate immediately, and you can download it, print it, and send it off wherever you need to in order to get your credits. I did mention there is a quiz. So you will have your notes. The webinar quiz is based on the printed material in the handout, so that's primarily how the quiz was generated. So make sure you are using that outline that you received when taking the quiz, so you can make sure that you're on track for all the questions there. Okay, now that we have our housekeeping taken care of, let's get into our learning objectives. So after taking this webinar, you are going to be able to learn a few different things. I want you to be able to explain the link between walking, longevity, and wellness. We're going to cover a few different areas that show that link. We're going to discuss the relationship between walking, function, and independent living. We also learn common gait compensations and how they can affect different types of movement. And we're going to break down the essential skills needed to improve walking ability. And then finally, want you to understand the different drills for strength and power to enhance walking. So a lot of different areas that we're going to be covering in order to help our clients with a successful walking program. Now, when we talk about gait or walking, there's a lot of questions and misinformation or just unknowns about this. So I think when we look at most fitness professionals write programs, they understand this idea behind movement patterns, that we're going to not just focus on muscles, right? We're not necessarily working with a bodybuilder that, we have a whole day devoted to a single muscle or body part. We understand this idea of the body working as a single unit, and it does this through a series of movement patterns versus muscle groups. And I think you've probably heard this before and have taken a lot of courses on it and probably implement it with your current training. So you'll see things like squat patterns and lunge patterns, hip hinges, pushes, and pulling. And we understand we can create a total body exercise program based on these movement patterns. But what is the most performed, most common movement pattern that we will actually see a client doing in everyday life? So you have the answer right there in front of you. It's one that we don't really ever talk about or ever see, and that is gait. We're going to move. We're going to move around more than we're going to squat and lunge and hip hinge and push pull. All of them are important, but we spend all of our time talking about those movement patterns, and we never really give gait the attention that it needs. So where are all the walking exercises? Now, sure, you can just go out there and walk, and that's a great start. And we're going to talk about just that simple step right there, how important that's going to be and how much benefit there is. But I think the big concern is with a lot of these movements, if they're not ready for this increased demand that you're about to place on the body, is more always better, right? If your client can't squat, and it's not just a thing that they just don't understand how to do it, but they don't have maybe the mobility, the hip mobility, the ankle mobility, or they don't have the control to do it, is more going to be better, right? They're probably going to compensate. And the more they squat, the more they learn how to compensate and cheat and maybe put excess wear and tear on certain joints. And now they have bad knees or bad backs. And is it because of the squat? We might blame the squat, but it was most likely that they weren't ready for that type of load. And I want to think of walking as the same way. So yeah, the easy answer is let's get out there and walk and move. And all those things are great. But if we're going to be doing it often and with a lot of volume, even if it is low intensity, high volume exercise is a problem if we're not doing it properly. So we want to make sure we are talking about good ways to set them up for success. And we want to talk about all the different types of drills, not just walking, that are ultimately going to improve their gait mechanics and their gait cycle. So I want to talk a little bit about some research, and this will be for your information, but also hopefully just giving you some more resources and information in your arsenal to pass on to your clients to really stress the importance of what we're talking about here, because it could be life-saving. This could extend somebody's life for years if they're paying attention and really working at these different things. Walking is great. Walking fast is even better. And this is the Grim Reaper study. So this is from the British Medical Journal back in 2011. And basically what they did in this study was follow a large group of individuals, and they measured how fast their walking pace was. So they wanted to see whatever their normal walking pace would be when they just chose how fast they would walk. And they followed this group of people for many years, and then they started to look at, as participants were dying, they compared how fast their walking speed was, and what they found was at a specific speed they saw a dramatic increase in mortality rate. So basically, the slower people were walking, the higher their mortality rate was, so the less long that they were living for. So the faster older adults can walk, the lower their mortality rate is essentially. So we see here that the Grim Reaper's maximum walking speed is just under 3 miles per hour. So that's what they found in this study. So just under 3 miles per hour is where this dramatic difference was. So there's nothing magical about that number. It's just that's statistically speaking, that's where they saw this cutoff. So we want to set that goal of not just walking. That might be step one. We just need you to walk more often. But step two is going to be we need to walk with intent, purpose, and and speed. So aiming for something like 3 miles per hour um, or 4.5 feet per second, that's going to equate to 135 feet in 30 seconds. So being able to cover that distance. So this there's many different ways we can implement this. We can start small and just see in 30 seconds, can you cover that distance, and then rest and stop, right? So it's almost like interval training with walking. So it's not like we have to shoot for this all at once, because that might actually be a bad thing. If they're not ready to walk at that speed, forcing them on a treadmill going at that pace might lead to issues. But we at least have our goal, something that we're trying to reach for. There's a few different studies, just as a side note, that we see this link with mortality, this an association between longer life and certain things. And I think that the big ones, not all are related to walking, but walking speed is absolutely one. So if longevity is a concern, and we're trying to live as independent and healthy and as we can, I think number one, let's focus on that walking speed, get them walking often and get them walking faster when possible. Number two is mobility in general, and we've seen the study, or probably have heard of the study, the Brazilian study, where getting up off the floor and getting down onto the floor was linked with mortality as well. So basically, when they had participants try and get up off the floor and get back down, the ones that had the greatest difficulty, again, were those that had the highest mortality risk over the next few years. So that ability to get up and get down with little support was critical. And another goal to work for. And one final one that I want to mention is grip strength. Those with a stronger grip strength tend to, or again, have the lowest issues of mortality rates as well. So walking speed, mobility, and grip strength all are going to be really important things to do. I know they're not all on topic here, but I figured I would bring those up. And I think the main thing is the goal is not just to walk fast. The goal is not just to get up and down off the floor, and the goal is not just is grip strength. It's all these working together, I think. But when we look at the big picture, it's basically saying those that are stronger and move around more tend to live the longest. And I think that's what we really want to focus on. So it's walking's a piece of it, strength's a piece of it, mobility is a piece of it, and putting these all together so we have a person that can do all of these things with relative ease. The longer you can do those things, the better off you're going to be. And that's essentially what we should be focusing on with our programs, trying to help our clients out, is focusing on those things. All right, so more fuel for your fire, for helping out your clients. And some of these might be obvious, and hopefully I'm not trying to convince you of the importance of walking, but really just to provide you more information, more resources to help motivate your clients that, hey, exercise is great for lots of different reasons, losing weight and all these different things. But as we get older, with longevity and health becoming the primary focus, maybe those things, we need more emphasis on those aspects of fitness, not just the weight and weight management piece of it. So here's a nice quote from Dr. Thomas Frieden with the CDC. The closest thing we have to a wonder drug, walking. It does so many great things, and it's free, it's simple. For the most part, most people can do this. They just have to make it a priority, and they have to practice at it and work at it to get better and better. But I just wanted to share a few studies that I think just show how such a simple thing can have a dramatic impact on a person's life. So, for example, walking reduces the obesity gene expression by half. So this was a study by the American Heart Association in 2012, and it's been established that there are 32 so far, and I'm sure we'll find more and more the more we look at the human genome, but 32 established predisposing genetic variants influencing obesity. This study found that 1 hour daily walking reduced genetic influence by half. So when we look at genetic expression, it's important to remember. So genes don't tell us everything. They just tell us kind of our, like it said, what we're predisposed to. So because you have certain genes for, diabetes, heart disease, whatever it might be, doesn't mean you will get those things. It just means that we've seen those with similar genetic mutations are at an increased risk, but you could go your entire life without any of those things. And just because you don't have those specific genes doesn't mean you can never get those things. But what we see is there are certain genes that do influence those characteristics, like obesity. So people that have specific genes are more likely to be obese. But remember, genetics play a portion of it, and there's also lifestyle. And really, it's the lifestyle activities that you do that turn on and off those genes, which will make them become expressed. So if you have certain genes that predispose you to obesity and you eat processed food, you don't exercise, you're sedentary, things like that, yeah, then there's a really, really good chance that you are going to become obese. If you do those things and you don't have those genes, though, there's a really good chance you'll become obese as well. But your risk is going to be higher when you have certain genes. So what the study was showing was that out of all these specific genes that they were looking at, just walking 1 hour a day reduced the influence of those genes by half. So dramatically reducing the chances of becoming obese just by walking, even when you are predisposed to that condition. So pretty amazing, just an hour walk per day. Also looking at breast cancer, so reducing risk of breast cancer by 14%. It's pretty well established that any kind of physical activity can blunt the risk of breast cancer. But the American Cancer Society found that women who walked 7 or more hours per week had a 14% lower risk of breast cancer than those who walked 3 hours or less. Right? So again, pretty significant reduction there. And to add to that, walking also provided protection even for women with breast cancer risk factors, such as being overweight. So those that were at higher risk for breast cancer, walking reduced the risk. So again, just helped fight even those that were at a higher predisposition to lower those risks there. It's great for immune. Again, most exercises is going to be impactful for the immune system. But walking can help protect against cold and flu season. A study of over 1,000 individuals, men and women, found that those that walked at least 20 minutes per day, at least 5 days per week, had 43% fewer sick days than those that exercised 1 day a week or less. And those that did exercise more often when they did get sick had less downtime and saw milder symptoms. So they were recovering much faster. So if you are going to get sick, you got through it a lot faster. So strengthening that immune system is critical. And walking, 20 minutes a day, 5 days a week, not asking for a huge commitment to see some of the benefits here. Walking and stair climbing can improve bone mass density. So another concern for many. Now this one, when you look at the research on bone mass density, increasing bone mass and fighting osteoporosis, not all studies will show walking being helpful. And this is why I want to make sure I mention the term brisk walking. This does have to be at a faster pace to really get the benefit. So with bone density, we need a certain amount of impact. And just a casual walk is probably not going to be enough to really strengthen bone mass. It may help prevent or slow the decrease in density, but we do need some impact. So faster walking, even running, and then stair climbing are all going to be preferred if this is going to be our concern. But like a lot of things we're going to talk about, if you're going to start a more aggressive walking program, then we need to make sure that the body's prepared for something like that. And finally, looking at mental decline, which we know can be a big problem in the elderly. So this looked at men age 71 to 93. This was out of the University of Virginia. And they found those men that walked a quarter of a mile per day, that's right, a quarter of a mile, one lap around a track or more, um, they saw half the incidence of Alzheimer's, right? So pretty unbelievable. So a quarter of a mile is not very far, and it may for some people, but I think that's an attainable goal for many, and we can see a dramatic impact if it's reducing incidence of Alzheimer's and dementia in half. Another study out of the University of California, San Francisco, looked at women, and they found that those who walked had less, just in general, less age-related mental decline than those that did not exercise at all. So both beneficial for men and women, even though I know it says just men here. Everyone is going to benefit from something as simple as walking. So again, I know I don't need to convince you of the importance, but hopefully this just gives you more information to pass on to your clients on a little bit will go a very long way. So anywhere that you start is going to have a dramatic impact in somebody's health, from a quarter of a mile to an hour per day. But the bottom line is we need to get people walking more. We need to get them walking faster. And we need to help prepare the body to handle this increased activity. So it's often that we see people start an exercise program, they start walking and it goes great for a week or two, and then they start getting those nagging injuries. So our job is to make sure that we influence their decision to become healthier and start walking more, but we don't just tell them to go walk more, we give them the tools that they need to prepare their body for this increase in activity levels. So I think it should be pretty clear of all these benefits of walking. And, we can talk about all the health benefits, with the dementia from increasing their aerobic capacity, living longer, getting better blood flow to the brain, all these great things. There's a ton of physiological adaptations that occur with regular exercise, such as walking. There's also the psychological benefits, right? When we exercise, we release those endorphins and we feel really good. And when depression can really become a problem as we get older, this might be a great way to help prevent that, hopefully, or supplement with maybe other things that they are doing in their life to help with that. But there's a ton of benefit. We want people being as independent as possible. And a person that can't walk, can't lift things, can't carry things around, can't live independently. They can't do the things they want, which leads to that cycle of they feel like they can't do anything. They get depressed. They don't want to do anything. They don't want to eat, whatever it might be. And we fall into that trap and go down that hole. So we're trying to do everything possible to prevent that and keep people moving, functioning as long as possible. And it does start as simple as walking, but hopefully we can go into a little bit more depth on all the different things that we can do to benefit them. Where we need to start is we need to find the exercises that improve the foundation for the movement, not just the movement itself. And that's what I want to spend a lot of today talking about, is not just walking. We can break apart walking, we can break down the gait cycle and do all those things, and that's fine. But we just need to make sure that they have the pieces. If they have the pieces that make up walking, they have the strength, they have the power, they have the core control, the balance, all these different things, then the body's going to be pretty good at putting it all together, so they're going to feel confident that they can walk again. So that's a lot of the exercise selections that we're going to do, is really piecing the big movement together. But another thing we have to really understand is, well, why aren't they walking already? Or if maybe they're just walking a little bit, why aren't they walking more? And I think it really comes down to these three categories. And they're different, and they will require different interventions from you. And we need to really think about this. So understand, if they're not walking or exercising or whatever right now because of pain, that's obviously critical to know. If every time they walk it hurts, me telling you to go walk more is a terrible idea, right? It's going to lead to probably more problems. We need to understand, well, what pain? What is it? Is it, your knees, your ankles, your back? Having a professional come in and help us in that regard. Sometimes walking will help, but we just want to be careful. We don't want to guess that, well, let's see if we walk it off, it'll feel better. And then we make it worse and now they can't do anything, right? So taking that extra step, having a network of health professionals that you can rely on to figure out, is this a pain that is manageable, that we can deal with, or is this something that they really need to get taken care of before we start a vigorous exercise program. What if it's difficulty, right? A lot of people, maybe they don't want to walk either because it is difficult for them or they think it's going to be difficult. Those are two different things, but to them it's the same, right? It's difficulty. So this is something we absolutely have control of. We can make walking easier. We can get them stronger, which is going to make and build their endurance, which will make walking become easier eventually. It is a process that they need to understand they have to work through. But we can also explain to them, sometimes people get stuck in, if it's not an hour, it's pointless. And maybe at the point they're at right now is they can't go walk for an hour. That's just way too long. They need to ease into it. So you, as the professional, showing them, hey, we'll get to an hour if that's what we feel is necessary. But I already mentioned that one study, one lap around the track, a quarter mile. It may take a few minutes, but we're not asking for an hour commitment here. We're going to start here and get here, and this is how we're going to get there. And that's your job. That's how you look at their goals and write a program based on their current activity level and where they want to go. So yes, it might be difficult, but we're going to start at a level that is appropriate for them and then slowly progress them as they get stronger and stronger. And then the last piece that we have a ton of control over is confidence. They may say some of the other things, but it might boil down to they just don't feel comfortable that they can do it. Now, maybe they can, maybe they can't, but it doesn't matter because right now they don't believe they can. So that's a problem. So what we're going to do, again, going off my previous point about, if we improve the foundation for the movement, they're going to feel more and more comfortable. If they have a fear of falling, if we improve their balance and we improve their strength and their core control and all these things, they're going to get better at balance and they're going to feel more comfortable doing things and moving around, and they're going to get that confidence. And with your help, they're going to slowly start to explore more and more movements that they now are able to do, including walking and hopefully other things as well. But that's what we want to do. That's probably what we do the best. We're going to get them to the point where they feel comfortable and confident in all these different activities. But it doesn't happen overnight, and we can't get to the finish line until we, put our shoes on and get to the starting line. So we want to make sure we start with that first step. We make it easy, right? We want to start to remove barriers. We don't want to throw a huge hurdle in front of them. We're going to take it one step at a time. What's that appropriate first step? I want to make sure you feel comfortable and confident, and then we slowly build off of that. We're going to get you to the edge of your comfort zone, but not beyond it. If you hang out at the edge of your comfort zone, all of a sudden you notice that that circle that makes up your comfort zone just got a little bit bigger. And the more you hang out there, the bigger it's going to get. And now you're doing things that you never thought you would do. So that's what a good coach is going to be able to do, is teach their client how to get to these difficult tasks and how to do it confidently. Okay, so let's look at some compensations that we have to be clear on. Like I mentioned, if we just say go walk, that might be okay at first, but we want to make sure they're not doing the wrong things, right? We're not looking for perfect form, right? If you're trying to look for the perfect squat or the perfect anything, you're going to be looking for quite a long time. We're looking for acceptable, right? Where they're not putting themselves at risk, and they're staying within normal ranges. But we want to just be aware of certain weaknesses that will lead to problems specifically with walking. So one thing I thought was important to just mention in general. So this first point here, normal gait is not possible with a loss of 40% of muscular strength. So as we get older, people tend to get weaker because they're less active unless they're doing something about it, like strength training or some form of exercise. We lose a significant amount of strength as we get older if we don't work for it, and that can lead to major problems such as not being able to walk normally. Now, you still might be able to walk and move around, but we're losing the efficiency and the way that we're supposed to walk. And now we're going to start developing compensations, potentially start needing assisted devices, walkers, canes, things like that. So this just stresses the importance of just general strength. If they're not doing consistent strength training, it's absolutely going to affect their walking ability. So the stronger you are, the better you're going to be at most things in life. Now, I'm not saying we need to be power lifters, but we just need to have adequate strength to be able to perform whatever tasks of daily living that we need to do. When we start looking at specific muscle groups, and weakness there, we see some issues coming up. So the first one, talking about walking speed. So our plantar flexors, like our calves, provide support and forward propulsion. Now, this is an area where we tend to see a lot of weakness, and when we have weakness in this forward propulsion, we start to see that decrease in walking speed. So I'm not saying just doing calf raises will make you a faster walker, but if I know that our plantar flexors tend to get weaker and tend to slow down speed, it's something that I want to work towards and really strengthening them to help maintain our walking speed. Our dorsiflexors, so our anterior tibialis, so the muscles that lift the foot up off the ground, we see a lot of weakness here. Sometimes we see some nerve issues like having a drop foot, and now we don't have sufficient clearance over the ground. This is where you see somebody trip over the carpet, right? They just don't pick their feet up enough. So if it's a nerve issue, that's one thing, but a lot of times it's just general weakness. So making sure we are strengthening the ankle, not just the calves to push off, but also the dorsiflexors in order to lift that foot up so we can clear the ground when we swing that foot through into the next step. The hip abductors are going to be a big one. So they're going to help provide vertical support. So when you're on one leg, so as we walk and that leg swings through, that stance leg, our hip abductors are going to be incredibly active there, keeping us upright. What we tend to see is weakness here leads to lateral trunk flexion. You're going to see the hips start to pop out as they start to walk along. So we see a lot of movement in the frontal plane when they're walking. So the hips kind of exaggerating that side to side movement. So we're seeing a lot of movement of the spine here, which could lead to some lower back issues, hip instability, knee instability. So our hip abductors are going to be really important for improving walking ability. And then the hip flexors, so they're responsible for driving the leg into that swing phase. When we have weakness here, it's going to increase the demand for the movement coming from the rectus femoris, which might add some more stress to the knees. With the hip flexors, sometimes our hip flexors get bashed a lot because we always talk about how tight our hip flexors are because we sit a lot and things like that, and that's probably true for a lot of people. But never assume just because a muscle is tight that it is strong, because oftentimes it's very weak. And we see this very, very often where the hip flexors are weak, and again, they can't swing that leg through, which can further cause issues with the dorsiflexors not picking up. We'll have to rely more heavily on those, and if they're already weakened, now we're just shuffling our feet along the ground because we're trying to get away from or trying to hide the fact that we can't pick our toe up and we can't lift our foot off the ground and swing the leg through because our dorsiflexors are weak and our hip flexors are weak. So making sure that we are focusing on exercises that are paying attention to these, right? We're paying attention to the ankles, we're paying attention to the hips, because these are going to be critical for walking ability. Okay, so let's start getting into the essentials. So what do we need to work on? So as I've said already, we need to get them walking more. So that might be a first step, is to just walk and just get out there moving because of all these great benefits that we've previously talked about. But like I said, we want to determine a baseline. We want to figure out where they are now to make sure that, hey, if we start walking more, are you actually getting better, or are we um, getting you further from your goal? Are we causing pain or anything like that? So we want to make sure that we're part of the solution and not part of the problem. So we want to make sure we are covering all of our bases here. So step one, I think, just like anything, let's figure out their baseline. Let's figure out where they are right now. It might be good, it might be bad, whatever. It doesn't matter. It's just where they are right now, because that's the whole point, is to see improvement. And while when it's great when they say I feel better, or it seems like things are going better, it's always nice to have specific markers to say you're clearly getting better. And there's a number of different things. You don't have to do all of these, but what I am recommending is that you pick something that you can use. All of these are pretty straightforward and simple assessments and tests that we can get a good starting point. So you can start with basic movement screens. So I'm a big fan of the functional movement screen. I'm not going to get into all the details here, but it's 7 movement patterns that you would take your client through to see how well they move. Now, it's not just looking at walking, it's looking at a whole bunch of different things, but where walking any issues might be exposed is during the hurdle step screen and ankle mobility, because we know those are 2 big areas that we're going to need. You need to be able to stand on one leg, go from 2 feet to a single leg stance, and we know that you need to have good ankle mobility in order to walk without developing any compensations. So those are parts of the functional movement screen that might be helpful. There's also the motor control screen too, specifically the lower body motor control screen, which you can look up more information on that, but it's basically looking about how well you can control movement in a single leg stance, which is going to be great as well. These are all great. Obviously, balance, we're going to talk more about dynamic balance, making sure that we have some type of assessment there. And we'll get into more on balance specific. Looking at more functional tasks, things like the time get up and go. We're looking at a number of different things here. So we will have our clients seated like you see in the picture here. They, on the go command, they are going to stand up without using the armrests, walk 9 meters, turn around, come back, and we're going to time how long it takes them to stand up, walk, turn around, sit back down. And there's normative data that you can use that will kind of put them in a category to see if they're in a good position, a good time, or if it's something that it needs work. But regardless, we have a starting point for them. Even if they're in the good or above average category, we at least can see, hey, this is where you were, and let's see if necessary, can we get it better? Another important test maybe is the 6-minute walk test. Again, there is normative data on this where you can compare to different populations, but really, again, get the baseline. So it's just at their comfortable walking speed, how far can they get in 6 minutes? And hopefully they get further and further as we build up aerobic capacity and endurance and strength and all of these things. They can walk further, which is a sign that their walking speed is getting better. And that was one of the big things that we talked about previously. So that might be a good test there. Just make sure you're not holding on to any railings if they're using a treadmill or something like that, unless absolutely necessary. So we have our baseline. We have we look at their movement, we look at their walking ability, and then we can kind of build our program based off of that. One area that, if we looked at their movement, we're probably going to see some restrictions in foot and ankle mobility. This is critical for proper walking mechanics. So in an older population, we just tend to see restrictions here. So there's a good chance, it's always important to look and see if it is necessary, but it's often a problem, and we need to address some mobility here. Looking at total body core stability. So I know core stability is a term that will get thrown around a lot, and we're going to look at a total body training because that's what we're talking about, right? That's functional movement. It's really looking at the core as a way to connect the upper and lower body and transfer forces between the upper and lower body. And that's what we see in walking. So we're going to look at specific core training to address that type of movement. And then, like I talked about, we have to look at lower body strength. So we want to make sure we are improving it there. The stronger they are, like I mentioned, typically the more functional they are, the more independent they are, and the more things that they'll be able to do. So rarely will we find somebody that's just too strong. It's a majority of the population, especially the senior population. We really need to focus on this because we know that there's muscle tissue loss, inactivity, and we're losing this strength ability. So we have to continually work on it. And then finally, power, which is a big part of this. Even if you're not walking fast, power is something we just always want to maintain. Just like strength, we lose it, we're going to lose it faster than strength because we know we're going to lose those type 2 muscle fiber types faster because, according to the principle of reversibility, the idea of use it or lose it. If you're not moving fast, if you're not lifting heavy weights, then we're going to see reduction in those fiber types and loss of the ability to move quickly and to lift heavier things. So we want to improve that power capacity. We want them to be able to move quickly because we don't know when they're going to need it. And we want them to have that ability. If they trip over something, they have the speed and the agility to kick their leg out in front of them or grab something with their arm so they don't fall down. So this is going to be critical for this particular population. Well, it's good to work on any population, but strength and power go hand in hand. So we want to make sure that we are focusing on both of those. So we'll talk about exercises and drills that we can do with all of these different things here. So starting with the foot and the ankle. Now I have this picture here because this is, in my mind, when I just picture the senior population, what do they typically wear when they're exercising or walking or things like that? And I did a quick Google search, and this is one of the first pictures that came up, and I thought this was pretty fitting. That we see very bulky, supportive sneakers that they tend to wear. Now, sometimes this is appropriate, but if this is the only type of shoe that they're wearing, we have to realize that there is a consequence to this. If they are not allowing their feet to do what their feet are supposed to do, again, the principle of reversibility, they start to lose that ability. And what I mean by all this is, as we wear these very supportive, thick-soled shoes, they provide all the support. They do all the work for the person, so your feet really don't have to do anything. Try and feel the ground with your toes wearing shoes like this. You can't. It's you're like on a pillow, and there's nothing you can really feel there. So this is a problem because it means the feet aren't allowed to do what they're really built to do. When we look at the anatomy of the foot, we see all these small stabilizing muscles. We see how many hundreds of joints there are in the feet, and we see all of the nerve receptors that are there because they're constantly providing information about our environment, giving us feedback. So we need to know, hey, do we need to shift our weight, move, bend this way, that way, whatever it might be. And if our shoes are not allowing all of this to happen, it weakens our nervous system, so we don't have this response anymore, and we don't give the brain and the central nervous system the information it needs to make an appropriate motor response, whether it's to step or to move or react, whatever it is. So I'm not saying that we should only be barefoot and always train barefoot, but I do think we should be barefoot sometimes because it will enhance the ability of our feet to do their job. And if all we wear are shoes like this, we're going to run into issues. Now, I know depending on where you train, if it's in a facility, you might not be able to go barefoot. There might be rules against that. So it's a great idea to provide homework, and we'll go over some drills that they can do that even if they can't do it with you, they're really simple. It gets them with their shoes off and training the different joints of the feet and the ankle. So if we look at some numbers here, the big toe should have a lot of movement. It should have a lot of extension. So we should see about 50 to 70 degrees of extension. Now, it may not need that much all during walking, but we do need a decent amount of extension. So as you're pushing off your foot, as you're rolling from the heel to the ball and then eventually to the toes, we need to see extension there. And a lot of times we see a lack of extension. There's the big toe is just rigid and it doesn't allow the rest of the foot to move. So if you picture that big toe just staying stiff, I mean, if you just, while you're sitting there, stand up, walk around a little bit and don't allow your big toe to move, what do you start to feel? You start to feel the bottom of your foot, those muscles tighten up a little bit more. The plantar fascia is going to have more force put on it, which will travel all the way up the Achilles tendon to the calves. And we can see there's going to be lots of stiffness. So now that big toe is causing stiffness in the foot and the ankle, which is going to lead to big problems down the road. So now, in order to walk, they're going to kind of go around their big toe and they're going to start to do things that they probably shouldn't be doing. And we'll talk about some of those. So with that big toe, we also see dorsiflexion becoming an issue. So we should see about 10 to 20 degrees of dorsiflexion during walking. And same thing, we should see that big toe extend. We should see the ankle flex. And that'll allow the rest of the body, the knees, the hips, all to do what they're supposed to do. But when we have issues right at the start line, right at where our foot meets the ground, it's going to affect every piece of the chain above that. So now we'll have some compensations. So we can really need to stress the importance of moving the feet, moving the ankles. When they can't, some things that you might see is, for one, an early heel liftoff, right? Because the foot can't stay flat and move the way it's supposed to. So they're going to lift the heel earlier. They're going to engage the calves a little bit more. They're going to increase knee flexion. So they're putting more force at the Achilles, and plantar fascia, which could lead to plantar fasciitis and other issues of those tissues. They have excess force being placed on the knee because the knee has to become more active because the ankles aren't doing the movement they're supposed to be doing. And then we have incomplete hip extension. So we hear a lot about the glutes and glute amnesia and the glutes not doing what they're supposed to do. And we have all these glute activation drills, which can be great, but during walking, you won't use your glutes if your toes and your ankles aren't moving the way that they're supposed to. So if they're restricted, you will never reach full hip extension, which means the glutes will never fire properly. So you could be doing all the bridges and all the glute work in the world, but when it comes to real life activity, the glutes are never exposed to the stress that they need to be exposed to in order to get stronger. So this is going to be critical that we make sure we improve the mobility and the strength of the feet and the ankle. So like I said, everything else up the chain can do its job properly. Okay, so what can be done to help with, if we talk about the big toe first, some mobility. So we need to get some movement. We need to get some extension in there. And there's a number of great exercises you can do. Here are a couple of ones that I think are a good starting off point. But just like anything, we're going to start with some stretching, some mobility. So we'll see on the video on the left here, we're just going to use a tennis ball up against the wall. That's just ideal because the ball can slip out sometimes, so this keeps it pinned in there. So most people have some kind of ball they can use. And we're just going to basically step on that ball and work on that extension. We can hit the big toe, but we can also get the other toes as well. So you can see I'm driving my knee forward. I'm getting a little bit of dorsiflexion as well, but I'm just trying to enhance that stretch as we get extension there. Now, with some of these drills, the goal is to kind of hang out here for a while if they tend to be stiffer. So we probably want to add some work on up to 1 to 2 minutes of stretching here. It might be uncomfortable at first, and if it's not something they can handle, we take what we can get. If they can do 10 seconds for now, and then we're going to work on improving that mobility. But the idea is being able to really get that big toe up into extension as much as possible. Now, anytime we work on mobility, we want to make sure we follow it up with some type of movement or strength work or stability or whatever you want to call it, basically control. So now that we've, hung out, gotten some extension in that big toe, let's make sure they know how to use it. So we're going to try and strengthen that range of motion. So we're going to do some toe raises here, which can be really challenging if you've never done this before. So you're going to try and keep your big toe pinned to the floor, lift your other toes, and then vice versa, keep your 4 toes down and then lift that big toe. And we're just going to be moving back and forth. So trying to get some extension, but using your own strength in order to do it. So this is a great way to follow up some of that mobility work, is to kind of take those toes through full range of motion, or as much range of motion as they can get through. Now with some people, they might try this and they can't separate. So when they try and lift their big toe, all their toes come up, or however they can't separate that. That's okay, at least if they're working on some extension there. What you might have them do is, if they're sitting in a chair, or maybe just kind of use their other foot, if they pin their other toes down and then just kind of use some assistance and then lift that big toe up. And then again, they can pin their big toe down and lift the other 4 toes up, but kind of just taking them through full range of motion until they can really learn how to do it individually. But this is that idea, trying to retrain these muscles to do something, right? To work again. And if you have somebody who really can't move their toes at all, it's a sign that they really need this. And if they're really stiff, make sure you start with that mobility work, because there's no way they're going to be able to lift any of their toes off the ground. So get some movement in there, mobility, and then you can try and get some of that, some of those toe raises in there. But yeah, you'll see some people have really, this is not the norm, more the exception, but people who can basically move their toes like their fingers. They have such control over each toe, so it's pretty impressive. So not saying that's what we have to shoot for, but just wake up those feet, get some movement. It's going to really come in handy when they increase their walking, but really just in general, as they're walking around, it's going to help them out. Another great one, some toe scrunches. You may see this in kind of a rehab setting, picking up marbles, things like that. So it's not just working the big toe, we're working the, these intrinsic muscles of the foot, the stabilizers. So we're just going to try and crunch up a towel. So I'm doing it on a slide board here. It slides a lot easier. Depending on the surface, you might need to do something like that. And then you're going to see I'm also going to do the opposite. So it's just like any muscle or joint that we're training. We want to make sure we're training both sides of it. So a lot of times we see overtraining in one area. Somebody who's only doing bench press and nothing else, no pulling exercises, develops an imbalance. Same here. We want to work these muscles of the bottom of the foot, but we also want to train the ones on the top side of the foot that are lifting the big toe and other toes as well. So this is a great exercise, really simple to do. You could be watching TV and just doing our toe scrunches. You pull it in and then you try and push it back out with their toes. All right, and those are just a few examples of some foot mobility and strengthening exercises that we can do, but I think a good starting point. From there, we're going to move up to the ankle. So I mentioned dorsiflexion is going to be critical. We can work on all different types of range of motion: dorsiflexion, plantar flexion, inversion, eversion. I think based on what research is showing and just what, at least I've seen personally, dorsiflexion seems to be the big limiting factor. So we're going to emphasize that dorsiflexion. So here we have a great dynamic ankle stretch. So, to start off, any calf stretches are going to be great here. So, the kind of traditional standing up against the wall, pushing, all those are great. I like this one. It's more dynamic. I'm using a half foam roller in this example. It gets some great movement in the foot as well, because your foot kind of curves along the dome side of the half foam roller. But you can honestly use anything that will just lift the person up, because we're trying to put them into dorsiflexion, right? When you lift those toes up, now the ankle is already dorsiflexed, so we can enhance that stretch. So anything will work. I just like the half foam roller. And all we're going to do is a step. So we're just going to use the sticks for balance, because I'm not trying to train balance right now. I'd rather work on that mobility. So one less thing to worry about. If they don't have to worry about their balance right now, you can do it up against the wall or some other type of support. But all we're going to do is step as far forward as you can but you can notice my right heel is remaining on the floor the entire time. So I'm not locking my leg out. You can see there is a soft bend in that knee. And then we're just going to step as far as they can step. It might not be very big if they're a little bit tighter, or maybe they can step a little further. As long as we see that heel stay down, they step as far as they can go. But I like this because this is what we need ankle dorsiflexion for, right? As we step through in that swing phase, we need to make sure that we have adequate ankle mobility in order to prevent that early liftoff of the heel and all the other compensations that we discussed previously. So really simple, great drill. They can use a book at home. Great, easy to do homework here. And I am barefoot. You don't have to be, but like I said, if we can get a few barefoot drills in there, it really is going to help with improving that foot stability as well. Another great drill. It starts off kind of looking like our standard calf stretch, pushing up against the wall and trying to stretch the calves by driving the heel into the floor. We're just going to add different dimensions to it, different ranges of motion at the ankle, because the ankle does need to move. Even with dorsiflexion, it's not always just straight ahead that we need to dorsiflex. We need a little bit of range in that ankle. So we add a step driver where we're going to use so in this example, I'm stretching the left ankle, and I'm going to use the right foot to drive movement into different planes of motion. So you can see in the first one, I'm going to step across and then step back, and then we'll step forward, kind of a normal calf stretch, and then step to the side. And I'm trying to keep, you can see the foot is hopefully staying as flat as I can. I don't want my heel to lift off, just like on a normal calf stretch. And we're just going to get some different movements. So you can see as we reach across, we go into more supination. Then we're kind of neutral as we step forward, and then we're going to go into pronation, which those are normal movements. Sometimes when we hear supination and pronation, we think bad, but every step you take, you're going to pronate and supinate. We just want to be careful we don't see excessive movement in either of those directions. But if you're limited in pronation or supination, we're going to have some issues of the feet as well, and the ankle. So just making sure they understand how to get some good movement in that ankle with not just dorsiflexion, but here we're adding a little pronation, supination as well. Okay, so those were just a few examples, but any toe, foot exercises, any ankle mobility drills that are going to be important to implement here. If it's a person that lacks ankle mobility, lacks foot mobility or stability, these are things, honestly, they need to be doing all the time. Daily, multiple times a day if possible. We'll always take what we can get, but I think it's important to, when mobility is limiting us, and the older we get, the harder and harder it is to gain back that mobility. Tissues changing, movement changes, and it gets harder and harder to regain that mobility. And if we don't have very frequent exposure, we're not going to really see much benefit. I shouldn't say we're not going to see much benefit, but we won't see the gains that we could if they were doing it more often. Now, we might see them not getting worse, which is a good starting point, but we want to make sure that we are seeing improvements here. So those are homework drills that they should be doing every day. Maybe every session with you, that's how they start the workout. They kick the shoes off, they work on their feet and their ankles. It usually feels good, and nobody ever complains about getting some foot and ankle work in there. But that's great if they're doing it with you. But if they can do it at home, the reason I chose those exercises was because I think, you may not have that exact equipment that I showed, but you probably have something you can use, or they have something they can use, and get that work in daily. So the next factor that I wanted to talk about is core stability. So, remember what we're talking about. We are looking at walking. We're trying to get people walking more, and we want them to do it safely, and we want them to be as efficient as possible so we don't lead to excess wear and tear, joint pain, whatever it might be, the more they walk. So core stability is going to be a huge piece of this. So I kind of mentioned this already. The core is, obviously that's one of those words that gets thrown around a lot. Um, we're not going to look necessarily at muscles right now. Let's just look at what is our core supposed to do. It's the connection between the upper and lower body, right? We need the core to kind of hold us together, stabilize the spine, move the spine in some cases, and to transfer energy back and forth between the arms, the legs. Every step we take, your foot hits the ground, you generate this force, it travels up your legs through the hips, it's got to travel through the core to the opposite arm swinging. And if we have a disconnect there, we might be losing energy, have an energy leak where there's now an inefficiency, maybe excess wear and tear on certain joints because they're not staying stable during this movement. A host of problems can occur there. So it's critical that we understand that's what we're trying to get out of our core training. We're trying to get this transfer of energy. We want to see stability where stability is needed and mobility where mobility is needed. So we tend to see arm and leg movement with the core remaining in a neutral position, nice and stable. So when we're specifically looking at walking and gait, we can look at different systems of the core, if we want to call it that. So we have these pathways where energy will travel through, and that's why I wanted to bring up that's the kind of the point of the core is to pass on this energy. So we see this connection through muscles, through fascia, through this different connective tissue of these different systems, which include the anterior oblique system, the posterior oblique system, and the lateral system. And all three of these systems work together in order to move us forward so we can walk around and do things. I'm going to show some exercises that kind of stress one system over the other, but you'll probably notice that, well, really it's kind of working all of them depending on how you look at it. But I at least wanted to give you a few examples so you can see specifically what you can do to target these different pathways through the body. Okay, so let's go through a few examples of the anterior oblique system. So this is just like it sounds. It's going to run across the front of the body and it runs obliquely. So it's running from shoulder to opposite hip. So we will have the hip flexors on one side, across the abdominal fascia, abdominals to the opposite shoulder. So there's a few exercises that we can incorporate that will include this pathway there. We see this system used, honestly, with every step that we take. Think when one leg steps forward, the opposite arm is stepping forward. So if you picture the tissue between the hip and opposite shoulder, it's actually all engaging to create that opposite arm and leg swing. So one of our classic examples is the dead bug. Now, the dead bug exercise has a lot of different variations. What I like to do to further enhance that anterior oblique system and really enhance core stability is by taking a hand and placing it inside the opposite knee. When you do this, you're going to push. So the hand will push into the knee will push into the hand, and we're going to get that chain to activate right there. We're going to get the little bit of the shoulder, the pecs, core, and then into the adductor on the opposite side. So we have this nice connection right there. Now on one side, we have that stability, and then on the opposite side, we're going to create that reaching pattern with the arm and the leg as we keep driving that hand into that leg. So that just helps, really have no choice. They're going, if they push that hand into the knee, it's going to increase the stability there, and they're also going to feel it and become more aware of what's actually working here. Now I know with many of these exercises, we potentially might be on the floor on all fours, and for some clients this might be more difficult. So I wanted to at least show those options, because if you can do it, great, but I'll also have some standing options in case that's your best choice as well. So our other exercise, standing, we're going to be doing a step and press. So now you're going to see we're going to mimic that walking movement. So as one leg steps forward, the opposite arm is going to do a chest press. So again, we're focusing on using that arm to opposite leg, that anterior oblique system, to work together here as we step forward. So this is a nice one. It does take a little bit of getting used to because it's as you press forward and move, that band gets more and more tense and it really pulls you back. So you have to be able to control it back with each step. Moving into the posterior oblique system, so this is essentially the opposite, right? It's going to be the back side of the body. So we're still talking about the hip to the opposite shoulder, that connection there, but we're just looking on the posterior side. So we can use that same example with walking. You know, when your left arm goes forward with your right leg, think about what's going on the other side, right? Your left leg, if I remember the example I used, is pushing back. So we're engaging that glute as we extend the hip on that side. And then the opposite arm, the right arm, is going to be driving backwards as well. So we see that connection there between the opposite hip and shoulder. So one great example of a posterior oblique system exercise would be a bird dog. So we're going to flip that dead bug right on over. We're going to add one thing to enhance it here. We're going to I should say two things. We're going to add a band and a glider. So this is going to do a number of different things. So the glider, first of all, one of the big mistakes I see with the bird dog is the focus becomes on lifting that leg really high. And if people are tight in their hip flexor, they don't have great hip extension, and really raising that leg up high is just going to lead to low back extension. Which is obviously not something that we want to encourage with our exercise. So the glider just keeps their foot closer to the ground, much easier to keep within their range of motion, hip extension. The other thing is we're going to add some mini bands, just add some resistance now. So we're going to add resistance to that posterior chain. So here we can see an example of that. So you can see that leg is sliding back. We have good hip extension, and there's really nothing going on at that lumbar spine. We could have a glass of water just resting there as we stretch that band out, slide the foot back, and reach the opposite arm. Standing example, we're going to do a single arm pullover with a leg raise. So it's essentially the same movement. We're just going to be standing now, and we're adding resistance to the upper body here. So as we pull, you can see, again, opposite arm and leg. So as the left arm is pulling down, that left leg is coming forward and the right arm is reaching forward. So yes, there is an anterior component to this, but if we think about the posterior side, when you pull down, you're going to get that lat to engage, which is going to transfer right across the thoracolumbar fascia right to the opposing glute as you drive that foot into the floor and get that glute activation. So we have great posterior oblique system work here. All right, and then the third system was the lateral system. So this is kind of that frontal plane stability. So now forces that are pulling us side to side. You know, QL is going to be active here, obliques, adductors on the opposing side, and abductor, sorry, both sides of the hips are going to be working here. And the two big exercises that come up here, side planks and asymmetrical loading, carries or marching and walking are going to be great examples here. Side plank, I think, is pretty common exercise. I just wanted to go through some progressions if we're going to be doing the side plank and some cueing. So we're going to make sure that that elbow is right below the shoulder. As we start from a kneeling position, we're going to work on a tall posture from the head right through that spine, the shoulders, the hips, the knees. Most people just have an issue with hip extension. We want to make sure that we are focusing on full hip extension in this position. And we're just holding our side plank here. To progress, we can raise that top leg. So now we're getting a lot more hip work with our side plank exercise. Oh, start over here. So still from the knee, extending that hip. And then going the full side plank. And then we can even add a little bit of resistance to it with something like a sandbag, holding that up and adding more resistance when necessary. So all great examples of that lateral system challenging in that side plank. Our standing version, so asymmetrical loading, just walking with a weight. This we're doing it as a low hold position, kind of a suitcase carry. We can go rack position, we can change the angle up, but we're just putting load on one side. And just think of all the practical applications of this. How often are they carrying a single weight around? Think, kids, grandkids, grocery bags, purses, backpacks, luggage, whatever it might be. This is real world right here. So challenging them in that frontal plane is a great opportunity to help them get a benefit. Now, you can see in this picture, I started with what we don't want to see. So this is overcompensation. So they have an issue stabilizing, so they're going to overcompensate and lean the opposite way. So this is what we want to make sure we're watching out for, and we're cueing. We want to remind them to get tall. I might even, say, imagine you had a book on top of your head, or actually putting a book or something on top of their head to remind them they should be thinking about their posture and their integrity as they are doing this single arm carry. So you can see we're going to straighten out here, and it should look like we're just going for a walk. So I'll remind my clients that this is it's a posture exercise. We're going to try and build endurance with those postural stabilizers, and we're going to challenge them with carrying weight on one side. So just really watch that posture, watch that form as they're doing their single arm carries. Okay, so we're going to get into balance now. So we could definitely include core stability and balance at the same time, but I just wanted to make sure we made the point to talk about each individually so we can stress each point. So there's different types of balance, right? Obviously there's static and there's dynamic. Static is a great place to start, just giving them some confidence that they can stand on one leg or staggered stance or however we're going to progress them, that they can just stand and hold, and they're familiar with that. But we want to progress from that as quickly as possible, because how often are you just standing there on one leg? It's usually you're moving, right? And that's what we want to focus on. So it's not just about standing on one leg, it's about actually being able to move and react and do things like that. So it's easy just to balance something, but to control it while it's moving, that's another thing. So we want to make sure that they have that control. So we might start with something like a staggered stance or tandem stance. We're going to go through a little bit of a progression here and kind of check those boxes off. They should be able to stand in each of those positions for 10 seconds. Once they've gotten that down, then we want to start progressing to more dynamic drills, but we don't want to skip over things. So make them show that they can stay in these positions for at least 10 seconds. Longer is great. And then we start to challenge them. Remember, we balance through different systems of the body, the visual system, somatosensory system, and our vestibular system. So we're going to want to challenge those. And you're going to see some examples in the next few videos of how we might challenge them in each of these different postures. Okay, so let's go through a few single leg stance progressions. So we're going to start with the tandem stance first. So we're going heel to toe, and we just want to make sure that they can balance there. For some people, even though there's 2 points of contact on the floor, that's very unstable, and they might not even be able to get in that complete tandem stance. So you might have to stagger their stance a little bit, make it a little bit wider there. It's nice to maybe put a piece of tape or get them on a balance beam so they can see that they are in line, and just have them stay there. So once they've shown they can do a tandem stance on both sides, we are going to progress to a stork stance. So here we're still using the other leg as a little bit of a guide and to have some support there, but they essentially are on one leg now. They're just kind of helping themselves out here. All right, and then we're going to get to a single leg stance. And then we can do something like standing on an RX pad, and now, like I mentioned, challenging the different systems. So here, you're not going to be able to feel the ground as well because it's moving underneath you, so we have more of a somatosensory challenge. So these are just a few examples of how we can challenge balance. Obviously in all of these, we could have closed eyes, turned the head, all sorts of different challenges in each of these postures as well. But remember, in these static positions, we're just trying to get them to check those boxes to get a baseline of static balance before we move on. So next, we can progress into some dynamic balance exercises. And with dynamic balances drills, there's different ways we can challenge them. So you're going to see in this first example, we're going to be moving the arms, but the legs are actually staying static. So it's still a static balance with the lower body. We're not stepping or moving the legs at all, but we are going to be moving the upper body. So we're going to get in that staggered stance. Look straight ahead, chop the arms. You want to make it a little bit harder, we stay in the same position, we just chop a little faster. You want to make it even harder, now we're going to add that vestibular challenge. You can see I'm shaking here just doing this, and we're going to start to move the head. So you can see everything from the waist down stays stable. We start here with a simple arm chop, then we speed it up. Obviously you can add weight too if you wanted to, and then now you're going to follow your hands with your eyes for more of a challenge. So we are chopping in a particular way. We're chopping towards that back leg. When we switch sides, then we'll switch legs as well. Okay, here another vestibular challenge. We're going to add head turns. I really like adding head turns into our balance drills because, again, that's real life. You're not always just looking straight ahead. You could be walking down the street and you hear a noise and turn your head quickly. And we want to make sure you can react to that and get control of your balance. Or maybe walking with somebody and they tell you to look at something, and as you turn your head, if you're not ready for it, that could mean a fall or something like that. So practice those head turns, getting control, and relying on the different systems as one is being disturbed. So we're going to stay in that staggered stance. So we still have 2 feet on the ground, but now we're just going to add some head turns. So they can be slow. They can be quick. We can stop in the middle, or we can go right from side to side. I'm just going with the head turn side to side. Obviously, we can go up and down, and we can tilt the head side to side. So there's lots of different progressions we can use from there. Okay, now we're going to get into some more of my favorite dynamic balance drills. We're going to get on a balance beam. If you don't have a balance beam, it's just a tool that I highly recommend getting. I think regardless of the population that you're working with, so much benefit can come from a balance beam work. And this can be, there's great places to start for a beginner or somebody who does have concerns with their balance. And then obviously we can get very advanced and work on some pretty high level balancing drills. So we'll go through a couple of videos. Here are some great progression. So you might make it through all of these, or maybe just through some. So we'll go forwards, we'll go backwards, lateral, we'll step over things, we'll reach down, and we'll even add some distractions there. And for the balance beam, you can see in the picture here using a 2x4 or some type of wood. You can do tape on the floor, but I do highly recommend using something that's elevated. It does add a little bit of fear, which sounds like we're trying to torture them, but it adds that extra layer to the exercise. So they can fall off of it, but they're falling an inch, so it's not a high risk position, but it still adds that level of concern that they have to work through. So it's definitely getting them out of their comfort zone. And you can buy balance beams as well, which you'll see in some of the videos. So these are just rubber balance beams that you can use that are nice if you're barefoot, which again, I do recommend doing a lot of these drills barefoot because your feet get to learn what you're doing and work a little bit harder. One of the big things with balance beam work that you'll see here, the goal is to keep your gaze going forward. We're not going to be staring at your feet. I don't want you to get used to looking down when you have to walk, right? If you're walking around, I want you to look up so you know what's coming. So when we're doing our balance beam, you're using your feet to figure out what to do next. You're not looking with your eyes. You're going to keep those those eyes up. So the first couple passes, if you want that they're just trying to get used to it and build confidence and they need to look down, that's okay. But just know that really the goal is to keep the head up the entire time, just like when we're walking. So here we're going to see some forward and backwards walking drills, and I am going to use support. So we're using dowel rods here. So if you have somebody that's really struggling, we're just going to use some dowel rods to help them out. They use it as much or as little as possible, but we're going to walk forward and backwards, and yes, and we won't look down. And then we're going to get rid of those and do our walking there. We want slow, controlled movement. A lot of times they just run across it because they want to get to the other side before they fall off. We need to discourage that. We want this to be slow movement. They're in control. If you said stop at any moment, they'd be able to stop and maintain their balance and then move on from there. So if they're struggling, really going faster is not going to help them. We're going to remind them to slow down, to breathe, to relax, and just keep moving and feel the board with the foot, and wait till you're ready to take that next step before you move on. Okay, and then we can move into lateral walking, which, just like it sounds, we're going to have just the balls of the feet. So now you can see that challenge in the sagittal plane. It's a lot of forward and backward movement, where in the previous example, they have a lot of that side to side in the frontal plane instability. So this is just another nice way to challenge that balance in a different plane of motion. You can do with the heels on only. So there's different variations that we might do. Okay, then we can start adding obstacles in there. Here we're going to add a step. So we're just going to have them walk, and they're going to just step over the hurdle as they go. And again, we're trying to encourage them not to look down. So you can use your peripheral vision to really see where those hurdles are. And you can see in that example, I kept stepping over with the same foot. So I want to make sure that I do switch it up so both feet get to be challenged as they step over the hurdle. And obviously we can change the height of the hurdles to make it easier or harder. Okay, reaching. So now we're getting more advanced. Now we're going to level change. So we have a vestibular challenge. We have a strength challenge here. Or all sorts of things are going on here. So as we're walking, now we're going to reach for the floor. Then stand up, take a few steps, reach for the floor. And we do want to alternate, or just make sure we do get both sides, or both foot in front. And then if they can, we walk backwards. And the same thing. So definitely higher level challenge. Now I'm going all the way down to the floor here. You could have a table next to you and just reach down and touch the table, or a cone. It doesn't have to be all the way to the floor. Just the idea is a level change. So you can control what that level change is by just having an object or something that they reach down and touch. So just keep that in mind, that it doesn't have to be all the way to the floor. Okay, now the fun part. So we're going to add some distractions. So it is amazing how just little things will throw somebody's balance totally off. And it happens that way in real life. And that's usually what happens. They get distracted, they weren't paying attention, and something dumb happened and they fell down. So let's train them a little bit for that. So we can't plan for the unknown, but we could try. So what we're going to do here is, as they are going across their balance beam, and obviously you can pick any type of drill that you want to do on the balance beam. I'll suggest just keep it simple first, but you're just going to try and distract them. So you're not going to touch them at all. All you're going to do is you'll talk, you may yell, clap, wave a hand in their face. So you're going to see Frank here as he tries to knock me off. So he just starts clapping, trying to move my vision. Just mess with me. You can't hear anything, but he's saying things as we go, and he's just trying to disrupt my pattern as I go. So really simple thing. It's kind of fun. You can see I'm smiling. They're going to laugh as you do this, but it is a great way to challenge them by just trying to distract them as they complete their task. Okay, next up we can do hurdle stepping. Hurdle stepping drills are going to be great to really challenge that stability. So we're going to make them pick their feet up higher than they need to when walking, but it's great prep work for stairs and going up curbs and things like that. So really trying to get them away from shuffling those feet and picking their feet up so they have enough mobility, picking that foot up, and stability on the other leg to keep them balanced there. All right, so we'll just go through a couple, pretty basic drills, just stepping over the hurdles, picking those feet up. You're going to see oftentimes they go around the hurdles, so make sure they are stepping up and over that hurdle. Another drill is just focusing on one foot stepping over while the other one just kind of takes a normal step along the side. So this just enhances one side versus the other if we want to emphasize training one leg versus the other. Altering heights, so we can have some hurdles that are going to be higher, some that are lower, so they are just challenged. So it's, life is not always planned out accordingly. It's very random. So we change the heights, we can change directions. Sometimes they take big steps, sometimes they take little steps, but just to kind of get them ready for anything that they might face here. Okay, crossover steps. So you can use a hurdle, but probably better to use something a little bit lower on this one because we're going to be crossing the midline. So I like drills like this for a number of different reasons, but the main reason being if we're going to trip up or fall, it's often that leg can't cross over fast enough. So they might trip and they're going down sideways and they need to step up and over. So this is a great drill to work on their mobility and their strength, stepping across the body. So I'm just using a balance beam here, but really could use a piece of tape on the floor. They're just going to step over it and really working on that balance and control going in that alternating step there. Okay, another great dynamic balance drill is a band step. So here we're going to take a band, wrap it around one leg and then around an anchor. So that band is pulling in. So that stance leg is going to be challenged to stabilize more because the band's trying to pull it. So you're going to have to fight back a little bit. And then what we're going to do is step over with the other leg. So you can see in the first couple we have the band a little bit lower. And they're just working on stepping over without touching the band and staying stable on that stance leg. Now we can challenge it and we can move that up a little bit higher, move it up the leg a little bit higher, and see how much we can challenge them stepping over without touching. So I'm doing it without holding on to anything here. Obviously, if you want to have more stability, you can give them a dowel rod or something to hold on to there. Okay, so again, just a few dynamic balance drills. So just make sure you're training in different planes of motion, statically first, progressing to dynamic, and then hopefully I gave you a number of good ideas to start throwing into their programs. Next step is strength, and I've talked a little bit about strength already. The main thing is get stronger. Specifically with the lower body, but upper body is going to be helpful as well. But I mentioned that stat earlier. 40% reduction in strength, normal walking patterns are not possible. So we want to do everything we can to enhance strength. It's going to get them walking more efficiently. Their endurance is going to improve so they can walk for longer. They're going to be able to get upstairs and downstairs easier. So we want to make sure we are doing appropriate strength work for the lower body. So, focusing on the plantar flexors, something like toe walking, literally just walking on your toes, dorsiflexors, heel walking. We can do knee flexion, so working the hamstrings, doing like butt kicks, knee extension, step ups, lunges, anything like that. Hip flexors, hip flexors definitely need attention. We need to make sure they're strong enough to pick those feet up. Mountain climbers, high knees are going to be great. We see a picture here, of a wall mountain climber with band resistance to really challenge those hip flexors. So Again, just a few examples here. So any lower body drills that you're doing are going to be critical. Just make sure we're focusing on those particular joints and joint actions to enhance walking. Now, a couple things we can progress to once they have some basic strength levels. Lunges are going to be great. Now, lunges can be obviously challenging, and there's different types of lunges we can implement. We can provide stability, take away stability. So we want to make sure, though, lunges, working on more single leg type strength is going to be important, because we know much of walking takes place on one leg. Deceleration is a key concept that we have to consider. It's especially if we're talking about reducing fall risk and injury. Many people just really struggle slowing themselves down. So doing things that really enhance deceleration, or where it requires you to focus on deceleration, are going to be great training tools. So deceleration lunges are a great progression to work towards. So we can use bands to assist with a movement, and then we can use them to resist and make a movement harder. So something like a deceleration lunge. So we can see here, we're going to walk back with the band around the hips and go into a forward lunge. Now the band is pulling you forward, so it's actually making you kind of fall faster than you normally would just taking a step, which means when your foot hits the ground, there's more force coming through now. So you have to really focus on that eccentric component of the lunge and really slowing yourself down. So yes, this is going to be more of a challenging exercise, but it really enhances that type of strength that we eventually want to be able to work on. All right, so just focusing on strengthening walking and different movements. When we hear strengthening, we often think like our squats and machines and things like that. But there's lots of ways we can add resistance to movement, and bands are a great way to do that. So we have a couple different walking exercises that we'll go through here. So just walking. So having a band tied off, stepping back and forth. If you're holding the band, you can walk with them. Here I have an anchor, so we're just going to walk back and forth. We don't want to stretch out too far and risk snapping those bands. So we could progress into a march. So really working on picking those feet up, driving the arms. Really have to focus on that hip extension and pushing through. We'll get into the frontal plane and we'll do some side stepping, focusing on really pushing off the back foot. So in this case, the right foot to step left. So we get a lot of hip work there. And then again, focusing on that crossing that we talked about earlier. I think that crossover step really comes in handy. They never know when they're going to need it. And then we have our lunges. So we're doing a walking lunge and then a reverse walking lunge. Right, so the band is resisting us here, and then it's starting to pull us back as we come back, and it requires us to just decelerate much more. So this is a nice little complex, little warm up or workout depending on their level. Just all you need are some bands here, and then we resist those movements. All right, and, those are just a few examples, but I think most people are comfortable with strength. We just want to get stronger. The stronger you are, the more good things tend to happen. And then finally, once we have good strength and we're moving pretty well, we need to add some power. And when we say power, a lot of times people think, like the picture we see are powerlifting, Olympic lifting, and things like that. And all we really mean by power, you can do Olympic lifting. You can, take a heavy weight and try and move it fast, but we can just add speed to a movement and just move a little bit quicker. So a lot of the drills you just saw, what if I just did them faster? If I did the walking, forward walking, backwards walking, shuffling, I did it at a faster pace. That might be power development for some people. But the key is we have to master the movement first, right? We're not going to try and speed something up that they don't really have down. So we master it, we get it strong, and then we improve power from there. So I have this point demonstrate deceleration. That's why I wanted to, put a couple deceleration exercises in there, because if you want to speed up, you have to slow down, right? Because if you're going to sprint, you need to turn on the brakes. Otherwise, you're just going to run right into a wall. So we need to make sure that they understand how to slow themselves down. They have that deceleration strength before we start going quickly, right? Because that's where things tend to go wrong if they're not ready to stop and put the brakes on. Okay, so we're going to focus on a couple drills with power, but again, kind of emphasizing the deceleration part. So this is the fall and stick. We're going to essentially act like we're going to fall down, and then you're going to catch yourself. So we're going to lean forward and then quickly step out, and then we have a little dynamic balance here. You're going to have to catch yourself on a single leg, and we make them pause, then they stand up and return, then they fall forward, pause, and then back up. So it's kind of learning how to land before you learn how to jump, or learning how to brake before you learn how to hit the gas. We want to make sure they understand how to stop. So that's why we see a drill like this here. Walking ladder drills or running drills, agility drills, these are great power development tools. Now, first, they have to understand the pattern and learn the movement, and then from there, we add speed to it, where they're going to try and get their brain and their feet linked up and moving at the same rate together. If you're worried about ladders tripping, you can use tape on the floor. You can see in the picture here, you can even have tables next to the ladders in case they need a little bit of extra support there. But like I said, make sure they master the movement first. So we have a couple different examples that we're going to go through. So we have just walking or running, right? We're just going to move at the quickest pace they can do, whatever that means. I love going backwards. It really gets that brain firing and makes them think about what they're trying to do. So actually you're going to see on all of these, we're not only going to do it forward, we're going to be doing it backwards as well. But obviously make sure they master going forward first before we add anything onto there. Okay, and then again, just simple changing planes of motion. So now we're going laterally. You can see on these my arms moving too. I think that's an important point to bring up. It's not just about the feet. This is total body. Just like when you walk, it should be opposite arm, opposite leg. You'll see a lot of people where their arms just hang there and they don't contribute at all to the movement. And that's not what we want to see with walking, right? We want to see a strong arm swing as they're pumping those legs. So make sure you encourage that arm movement with the leg movement. Okay, next up we have the 1-2 step. Some people call this the icky shuffle. So 2 feet in the ladder, 1 foot step out. There's lots of ways you can progress this. Start off being close to the ladder, and then you start stepping out bigger and bigger. You can even add pauses if you want to add some dynamic balance. So they go quick, quick pause, quick pause. And like I said, we go backwards the same way. We start close, then you can get further and further away if needed. And I do like adding a little pause each time until they can really show they're in control, and then we go faster and faster through it. Okay, cross in front. You're going to be tired of me hearing it, but I'm going to say it anyway. I love that crossover step. So again, we're just working on getting that foot out in front of them across the body and moving side to side. This one you'll want to stay close to the ladder. It'll probably take a few tries to get this, and especially going backwards. But you need some great hip mobility, great control to master this one, and then we just keep working on speed, going faster and faster through it. Okay, some more power type movements we can do. This is foot stomping. So here it's just like it sounds. We're going to stomp down. So yes, there's some impact here. It's not a great deal, but impact's okay as long as we're watching our volume. And we've learned how to speed up and slow down. So this one, I'll tell people we're going to squish some bugs. So all we're going to do is stomp on these dots right here. So I'm going to do it with force. So I have dynamic balance. I'm going to pick my foot up nice and high, and then I'm going to step down, squish that bug there. So real simple. I'm just stepping laterally, doing just my right foot here. And obviously there's all sorts of progressions you can do. And then we could get the other side as well. But this is a great way to add power and dynamic balance into an exercise. And then just a progression from it, a reactive foot stomping drill. So there's no sound in this video, but essentially what's going on, it's the same exercise, but the trainer is going to call out which foot I'm going to use and which color that I need to step on. And once I hear it, I'm going to find that color, figure out which foot I need to use, and then stomp down as quickly as I can. So they'll call it out, I'm going to find it, step on it. I'll return to the start. The next one, they'll tell me what foot, and then I'll find the next one, stomp. So kind of a fun one to get them moving around, get them thinking, reacting, which foot I'm going to use, which color. It sounds simple, but you're going to see people get crossed up here. Okay, forward and backwards walk. So I kind of touched on walking backwards, but there's a lot of benefit walking backwards. You'll see it a lot of in a lot of programs for like post-stroke rehabilitation, just because of the impact it has neurologically with walking backwards. So if you need to be right next to them and support them, obviously we want to be safe with something like this, but we're just teaching them not just to walk forward and backwards, but to how to shift their weight. So you can see on the picture on the left, shifting, leaning forward in order to accelerate and walk forward, or run if we're at that point. And then leaning back to walk backwards. So they're learning control, moving forwards and backwards. So pretty straightforward, but we can see here. So I can add speed, and I'm going to walk as fast as I can, and I'm just going to work on leaning forward, slow down, lean back, speed up, lean forward, and back and forth. Right? And you can do cone to cone. You can tell them when they should switch, and then they have to work on reacting to you. But pretty straightforward here, just learning how to shift center of gravity back and forth. Med ball drills are awesome. This is a great way to implement power, upper body power with throwing the ball. But anytime you can involve lower body movement, it's going to be ideal as well. So here we're actually going to have a stepping motion. So since we're talking about walking, we're going to really focus on pushing the foot into the ground, driving through the hip and extending the hip as you step through and throw the ball. So you can see I'm going to really drive off of my right foot, extend through my right hip, and then push the ball. So here, talk about core training, right? What did we say the purpose of the core was? To make that connection between the upper and lower body and transfer energy. So the energy starts by me pushing my foot into the ground. It travels up the leg, through the hip, through the core, and then ultimately through my hands so I can throw that ball nice and hard. So this is a great total body power drill that we can do. All right, so now we put them all together. So I kind of broke those down into pieces, but remember, you saw a lot of them where they incorporated a lot of different types of these skills, these fundamental portions of the movements of walking, the core, dynamic balance, strength, power. There's no reason you can't put them all together. And then you can have fun with it and add games and different challenges for them. But that's the ultimate goal. Let's do some things that work on mobility, core control, balance. Let's strengthen lower body weaknesses if they have any. Let's add some power, and then get creative. Combine them for fun and innovating drills that are going to keep them excited about working on this and coming back. So I'm just going to finish up here and go through a couple different drills just to give you some ideas, and hopefully you can get even more creative with some of these. So trading places drill. So some of these you'll need a class or a group of people that you're working with, but not always. You can get creative if you only have maybe 1 or 2 people as well. But for this drill, everybody's going to start in a circle, and they could be on unstable objects, they can be on the floor, whatever it might be. And on the signal, they are all going to cross to the opposite side. So you can put like those agility dots and everybody's standing on a dot. And when you say go, they all have to cross. And you can see as these lines come together, it kind of turns into chaos. Now, this is kind of organized chaos and planned chaos because we want to see what they do. If you're trying to get to the other side as fast as you can, what if the guy next or woman next to you is trying to do the same, or the one coming at you? You have to learn how to avoid that person and not just smack right into them. So they need to step to the side, they need to slow down, they need to speed up in order to make their way across. So we go across, and then they can move to the left or the right, and then we just keep repeating. And you can have them do exercises while they're standing in between to work on maybe one of the other things, balance or strength, whatever it might be. Obstacle courses are great because we can add all of these different components and just keep them moving. And we get even a cardiorespiratory response to this, where they're, improving their aerobic capacity, which is always a great thing. So they just keep moving, get that heart rate up, and they're working on different things, going through a ladder, stepping on unstable objects, a balance beam, hurdles, literally combining everything that we talked about. Maybe one spot's a stretch that they can do, and they just keep moving the whole time until you blow a whistle or you clap or something like that, and everybody has to freeze where they are, right? So they're gonna have to decelerate, and then when you say go or blow your whistle or clap or whatever it might be, they speed up again, and we just randomly will do that. So they're never sure when it's going to happen, but they're going to have to react to it. Herding cats is a fun drill. So this is we'll need some balloons, and they essentially just have to make their way as quickly as they can from one side of the room to the other, while keeping a balloon floating up in the air. Now you can allow them to use both hands, one hand, their dominant hand, non-dominant, they have to alternate, they can use their head, whatever, you can get creative with it. But if you've ever tried to, bat a balloon and get it to move quickly, you know why we're calling this herding cats, because the harder you hit the balloon, the more crazy it's going to get. So they're going to have to learn how to control it. And the great thing here is obviously we're moving around, but they're going to be moving their head all over the place because they're going to keep their eyes on that ball. So it's getting them more confident to, hey, you don't have to look at the ground. We're going to distract you a little bit and get you looking at the ball the balloon as you're walking across. And they might have to go left and right as that balloon gets kind of blown to different spots. They will react to it and make their way across the room. So this is definitely a fun drill that they can do. All right, this next drill is a figure eight walking, and you can just walk a figure eight, but we add a little bit to this by keeping your gaze fixed on a point. So you can, mark an X on the wall or whatever, but they're gonna look at one spot the entire time that they're making the figure eight pattern. So you can see the head will stay fixed, and they're gonna walk, run, whatever they can do, but we do want to go for speed and see how fast they can move around while keeping their gaze. So again, we get those head turns. You can see we cross over as we make those U-turns. So there's a lot going on here, but this is a great drill. Another fun one, if you have, you can do this as part of a class or partners, or you can do it on your own. The mirror part is if there's somebody else going at the same time of you, but you can place 1 or 2 rows of dots, so you can have 6 all different colors. Here you just see 1 row. If you had partners going head to head, there would be colors on the other side as well. And you make the starting point 10 to 20 feet away. They are going to walk as fast as they can to the line of dots, and you as the leader will call out colors, and they are going to shuffle and have to tap. So it could be 1 color, 3 colors, whatever. They might have to memorize the pattern that you do, and they just have to tap it. You can have the foot stomps, and they can do that. And they just touch it as fast as they can, and then they return to the start. So you can do backwards walking, or they turn around and just walk normal. But a nice way to add a little bit of deception to it, if you're going head to head, don't have the colors match up. So if you say yellow, and it might be where you see it here on this side, but it's on the opposite side on the other side. So they are going different directions. So it kind of could confuse them a little bit. So it just adds a little bit of a challenge there. Okay, here we have a structured ball slam. So they have to make their way through our little course here and just slam a medicine ball, so a little bit of power work here on each dot. So we're going to hit every dot here. You could say, hey, you have to hit certain colors, or I'm going to shout out the colors and you have to find them. So there's lots of different progressions that you can do, but we're just going to have them give a big slam like they're trying to crush a bug. As they make their way, they can do it completely random, however they want to get through, the fastest they can do it, slamming at each stop there. Here is the standing the color drill. So participants will start in the middle, so where you see the X there, the leader or you will call out a color or colors to get the client to move, to tap that color with their foot and return back to the middle. So it could be, a single color, purple. And here we actually have two purples, so they might just touch, whatever one they want, or they might have to touch both, whatever it might be. But it's them in the middle, and then they just move out, touch, come back. And again, a million variations you can do. They can be in the middle, and they can be doing, squats, and randomly you'll call out a color, and they have to go tap it, come back in, and then perform squats again, or move on to another exercise, whatever it might be. All right, another kind of obstacle course type drill. So you're going to set parameters that they're going to follow through, and if it's one person going, it's pretty straightforward. If you have multiple people going, as they're walking around, they might cross, they might have to speed up, slow down, so it adds a little bit to it as well. So we're going to start at A, so they're going to walk to B as fast as they can, then they'll laterally walk or side shuffle from B to C. They'll have to make a U-turn, so we'll get some of that crossover stepping, walk C to D, and then they're going to laterally walk the other way from D back to A, make a U-turn, and repeat. So again, those U-turns we're working on crossing over, controlling center of gravity, and they're trying to get through this as fast as they can. You could have stations at each dot, at A, B, C, D. They could be different exercises that they have to do before they can move on to the next station. All right, and here's a strength and agility squat course. So we can start at A. These dots here would actually be chairs or boxes or something that they have to sit in. So they have to, so from A to B, they're going to weave around the chairs. So whether they're chairs or cones or whatever it might be. When they get to B, they have to sit in each chair. When they get to C, they're going to weave again around to D, and then again from D to A, they're going to sit in each chair. So again, just another way, giving you ideas for obstacle courses that they can go through, and giving them a variety of challenges to work on. So you can picture all the different things that we've talked about and how can we implement them into an obstacle. So we can add things to this. We can, all right, so we have some squatting, so we have some lower body strength. We have some agility, trying to weave in and out the cones. Maybe you want to add some balance. So maybe at C and D, they have to do one of the dynamic balance drills that we talked about previously, and maybe A and B, they are doing maybe some type of med ball throw or slams and a little bit of power training. So lots of variety that you can put in here to add all of these different components. Don't think that you have to train one alone. We might start that way, but then progressing them to add these different components in. Okay, so we made it through the course. Just again to recap everything we've talked about. Remember, we're trying to keep our clients functional, independent. All the research is showing us how important walking is for a variety of reasons. So step one is to make sure they're on a regular walking routine. Step two, how can we incorporate all of these different things that we talked about to make sure that we're not overloading their system too much. We're making sure that they're ready to handle this increase in load and activity to keep them safe, keep them healthy, so they can walk for years and years to come. So now that you've completed the webinar, remember, just a reminder, how you're going to get your CECs for the course. You'll log on to the website at exerciseetc.com, click on the administration tab, and then you'll click on webinar on demand certificates. Remember, the title for this workshop was Walk the Walk, Functional Ambulation Drills. There are some similar ones, so really make sure that you pick this one because there is a 20-question quiz. So we want to make sure that you're taking the right quiz and getting the correct credits for the course. You'll also complete a brief evaluation, let us know how we did, and then you can get your certificate that will be emailed to you so you can report it however you like. And don't forget that the webinar quiz is going to be based on your printed material that you have. So you're going to want to follow along on there as you take the quiz to make sure you know all the answers on there. Thanks again. My name's Mike Diebler. I really appreciate you taking the time and joining me the last few hours on this webinar, and I hope to see you again either on another Exercise Etc. webinar or at one of our live courses.